Hello, everyone. I want to talk about this quick preprint paper out of Bangladesh, and a bunch of people in the United States kind of helped do the study as well, from Stanford, Yale, Berkeley, lots of different places, uh, Hopkins, as well as people in Bangladesh and in Australia. What they did is still looking at this idea of whether masking helps or not. And kind of beating a dead horse because there's been several papers now that show that masks work in reducing transmission. And there's not too much debate about it, but they wanted to do a randomized population level trial with lots of people because most of the trials up until now were kind of like small numbers of people, under 100, under 200, in kind of more controlled situations. But they wanted to do a large study, and they did do a large study. What they did is they randomized 600 villages representing 300,000 people into uh, masks, surgical masks, cloth masks, and no masks. And you can't force people to use masks. So what they did is they just provided certain villages masks and gave them information and try to encourage them to use masks. And other villages, they didn't do anything other than observe them. And in some villages, they give surgical masks. Some villages, they give cloth masks. And so what did they find out? So it's a large study, 350,000 people, and it was the villages were geographically distributed throughout Bangladesh. So you had mask intervention villages right next to not mask non-intervention villages. So that kind of eliminates the possibility that there were like viral spread in certain parts of the country, and you just happen to get that as a confounding factor. So it was a well done study, and what they found out was that by doing the intervention, mask wearing went up from 13% to like 42%. So it's not a high, it wasn't like 80% of the villagers were wearing masks. They only got up to about 42%. And what that did is it reduced COVID-like symptoms from about 7.6%, uh, from 8.6% down to 7.6%, which is about a 9% drop. So an increase of about 30% in mask wearing decreased COVID-like symptoms by about 9 to 10%. And then, so we don't know, is this a linear scale? Probably it isn't. Like if you had people going to like 80% mask wearing, would that just give another 2, 3, like 20, 30% decrease in symptoms, symptomatic infection? Or would it be even higher, or would it be lower? It's probably a non-linear response. But what this shows is that indeed mask wearing does does reduce the symptoms of COVID-19 over a large population. So it's kind of the trial that some people wanted. Like in a population level study, can you show that mask wearing helps? It's not a dramatic improvement, 9.3% isn't great, isn't like 50% better or 60% better. But then the increase in mask wearing wasn't that great either. And you can't force people, especially in populations of this size, to do what you want in order to run a study. So they just try to educate and encourage them, and it did help. It did increase mask wearing quite a bit, but not a dramatic amount. But anyway, I'll link this paper below for anyone that's wanting to read the whole thing. It's 94 pages. It's a lot of supplemental data, and a lot of it is just talking about how they educated people, and how much these masks cost and things like that, that are more for policy people than other things. But basically, this is a randomized community level trial showing that masks work and they do reduce transmission.